Hello, good evening. Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our Tuesday Open Clinic. Today we're going to look at fertility window. Fertility window, what's fertility window? How can fertility window affect your fertility? And how can the knowledge of fertility window improve your chances of becoming pregnant? So that will be the topic for this evening's discussion. So once you come in, let me know who you are. My name is Dr. Trudy Ufondu. I'm the convener of this group, and we'll meet every Tuesday by 6 p.m. Eastern Time, then every Saturdays by 12 p.m. Eastern Time. 6 p.m. Eastern Time US is equivalent to 11 p.m. West African Time, using Nigeria as an example. 12 p.m. Eastern Time US is equivalent to 5 p.m. in Nigeria. So if you're currently gearing up for this particular broadcast, it's going to be very interesting to know the rudiments, the basics, things that will help you to improve your chance of becoming pregnant. So without wasting much time, I'm going to start. When you come in, you join me. After my presentation, I'm going to take care of your questions. So when we talk about fertility window, what do we mean by fertility window? I'm going to use my teaching model to help us understand it better. Okay? So fertility window simply means the time in your menstrual cycle you have the best chance of becoming pregnant. Is a tentative period of approximately 7 days in your cycle when you have the best chance of becoming pregnant. Now, there are a couple of conditions you have to meet before you start applying fertility window concepts in regards to achieving pregnancy or avoiding pregnancy. So when you hear people talking about safe, unsafe, fertile, and non-fertile period, they are actually referring to your fertility window. Within your fertility window, it's the unsafe period. That means that's the period you can easily become pregnant. Now, any woman at any time can become pregnant any day in her cycle, depending on her own unique factors. Now, fertility window is a period of just about 5 days before your ovulation. So one of the cardinal things we have to understudy and understand properly before we can begin to apply fertility window is what? Ovulation. Fertility window is that period of 5 days before your ovulation, the day of your ovulation, and a day after. So the day of your ovulation, a day after, plus 5 days, that's a period of 7 days. So it's a period of 7 days in a woman's menstrual cycle when she has the best opportunity, the best probability, the best chance of becoming pregnant. Now, some people might also use this natural method to avoid pregnancy, but be careful, it's not reliable. It's very passive. It can fail you. We normally use the fertility window concept for people that want to become pregnant, because about these 7 days is when you have to increase your potentials, increase the frequency of meeting your partner so you can become pregnant naturally. Now, there are some caveats. Fertility window concept is not applicable to all women at all ages. It works better when you are younger and you have regular predictive cycle. If you don't have regular predictive cycle, fertility window calculation is not for you. Ovulation calculation is not for you because you can ovulate anytime. But when you are younger, that means you are below 35 and you have a predictable cycle. The normal cycle is from about 21 days to 37 days. but most women will have 28 days. Now, let me use 28 days to teach so that you can plug in the numbers. But if your own is not 28 days, it's still okay. Don't worry about it. So long as you are fluctuating between 21 days and 35 days, you are supposedly normal. The problem begins when you bleed before 21 days or you bleed more than 35 days. So what do I mean? Every 21 days you are bleeding for at least 2 days, up to 7 days. Every 35 days you are bleeding for at least 2 days, up to 7 days. Once you have that bleeding contained within 7 to 2 days, it's normal. So the condition to apply your fertility window is to know your age. Now, there are so many factors that can affect fertility potentials of pregnancy in a woman. Now, regardless of your age, the best way to improve your chance across all age gaps in regards to achieving pregnancy is what? Frequent love making. And in our group, we are the love making group. We encourage women to make love every other day. But please, if you are younger and you have a couple of factors that might not be in your favor, maybe your partner is not available, maybe your partner is calculating the best time to come home so that you guys can make babies. Please make sure your partner knows your fertility window, especially if you are below 35 and you have a regular predictive cycle. Let's use, for example, Chioma has a 27-day cycle. She has had 27-day cycle and she bleeds for 4 days since she started bleeding. Her period must come every 27 days and she bleeds for 4 days. Does Chioma have regular cycle? Yes. Can Chioma calculate her ovulation? Yes. Can Chioma apply fertility window concept towards becoming pregnant? Yes. Why? Because she is younger than 35, because she has a regular predictive cycle, because she has a regular bleeding duration of 4 days. So she has an advantage. But if Chioma's cycle is all over the place, 21, 35, 50, 60, all over the place, can she apply calculating ovulation? No. Can she apply fertility window? No. When can she become pregnant? Anytime. So a woman can become pregnant at any time in her cycle. But please understand that if you are younger, you have a better chance of calculating this and applying the fertility window concept. Now, let's talk about the mechanisms behind the fertility window. Why do we have the 5 days before ovulation? And why do we add extra day after ovulation? Now, the sperm, which is the complement that will help you to become a mother. So the sperm is what you're seeing right now, okay? Now, this is a very rugged cell. So what I mean by being rugged? The sperm can survive in the vagina up to 7 days, but we normally go with 5 days. So if your partner makes love to you, deposits the sperm in your vagina, that sperm can still have some live, active, motile sperm that will get you pregnant up to 5 days. So using 5 days life cycle of sperm. On the other hand, the egg can only last for about 24 hours. So once the egg is released, if it's not fertilized, within 24 hours, the egg will no longer be viable for pregnancy to happen. Now, can your partner make love to you on Monday and get you pregnant on Wednesday? Yes. How? Remember your fertility window. So the reason why we teach regular lovemaking in our group is to make sure that at any point in time, when you get to the vagina, we have available good sperm waiting to get the woman pregnant, because the woman can release her egg by 12 a.m. and you might be waiting to make love with your partner, and before you know it, the egg will no longer be viable. So the key word for couples that want to become pregnant is to make sure that you make love every other day. Now, please, if you are having problems with love making, please at least Concentrate your lovemaking within those 7 days. That's when you have the best chance of becoming pregnant. If every other factor that will aid in ability to become pregnant is constant, remember that pregnancy is a complex process. Sometimes you'll be perfect, your partner will not be okay, and the problem will be coming from your partner. Sometimes both of you will be okay, and you guys will still not be pregnant. It's called infertility of unknown origin or unexplained infertility. So you have to check all the boxes. But this is what a woman can do for herself to see how to improve her chances of becoming pregnant. So it's expected that every woman should know her cycle. Know the regularity of your cycle. Plug your cycle. Document it in your cell phone. Put it in a graph. Do whatever you need to do to track it. Let me give you an example. You can start tracking your period. You can start tracking your cycle from January, especially if you are above 35. Who can tell me why? Because when you get to 35, there are so many hormonal changes that happen in your body. Remember the process of making a baby. I want you to remember factor 14. So in this trauma that has 28 days, 27-day cycle, what will happen? We apply factor 14. So if we apply factor 14, if we go to 27 days and we minus 14, how many days are we going to have? 13 days. Now let's throw some numbers out there. Assuming Chioma bled on the 2nd of January, 2022, and she has a calculated ovulation tentative day of 13 days. How did we arrive at 13 days? Remember your factor 14. Remember that Chioma cycle is 27, right? So if you minus 14 from 27, you will have 13 days. Now, if Chioma bled on the 2nd of January for the first time, right? That's the first day of our bleeding. Remember, we mean bleeding, not spotting. Now, if we count 13 days from the 2nd of January, on the 13th day, about the 12th day, the body will start changing in a couple of hormones. There is a hormone that will now be the person that will tell the whole world that the egg is about to be released. It's called the LH hormone, luteinizing hormone. The level will go up. It's called LH surge. Once LH surge goes up, within the next 24 hours, everything being equal, the egg will be released. Now, by the time the egg is released, there are other changes in the body that will help to make sure that pregnancy will occur. One important hormone is a hormone we call progesterone. When you are getting ready to receive the baby in the womb, the level of progesterone will start increasing. The ovaries will be producing progesterone, and a couple of other places in the body will be producing progesterone. Progesterone will go to your cover of your womb, which is called the endometrium, to prepare it to receive the baby. Now, if everything goes okay, the sperm came in, the eggs came, they became fertilized, they formed an embryo, they will start the process of going down to start developing in the womb. That process is called implantation. Now, if pregnancy didn't happen, the problem might come from the egg, the problem might come from the sperm, the problem might come from the implantation problem, the problem might come from tubal blockage. When pregnancy doesn't happen, the cover of the womb, which was already getting ready to receive the baby, will disintegrate. When it disintegrates, you will pass it out as your monthly bleeding. This is the mechanism that leads to normal pregnancy. So at any point in time, in any of the areas I mentioned, anything that leads to problem will affect your ability to become pregnant and lead to delay. But today, I want you to take home your fertility window. Your fertility window works better if you are younger than 35, regular predictive cycle. You don't have abnormal body weight, so your BMI is not higher than 25.5. Your BMI is not lower than 18.5. You are not into extreme sports. You're not using any recreational drugs. You're not using any hormonal drugs. You don't have sleep problems. You don't have toxic relationship. Then by default, we can predict when you can become pregnant. But if any of the things I mentioned, it's troubling you, if you have some medical problems, if you're taking some drugs, if you are not sleeping, if you are stressed, if you have hormonal imbalance, if you have excessive body weight, they will affect your ability to generally perform the way that God made you. And when that happens, you'll have irregular period. So women that have irregular period can still become pregnant, but they will not and should not practice timed sex. You do not practice ovulation, lovemaking fertility window, lovemaking, especially if you're above 35. The reason is because the day you might think you are ovulating, you might not be ovulating. So if you keep waiting for a particular time, once you miss that opportunity, you're going to start all over again. A woman has only one chance every month to become pregnant. Once you miss that chance, you start all over again. Unfortunately, there are some women that did not become pregnant in April. What will happen again? They will start counting down again in May. Let's use April as an example to talk about fertility window. Okay? Assuming you bled, you have a period of 29 days. Let's use 29 days. And your first bleeding in April was on the 3rd of April. You have 29-day cycle. What do? You apply factor 14. When you apply factor 14 to 29, what are you going to get? 15, right? Now, if you bled on the 3rd, the first time, and you're going to bleed, say, for 3 days, if you count 15 days from 3rd of April, on the 15th day, you will likely ovulate. Now, if we apply our fertility window 5 days before the 15th day, your fertility window will open. Then your fertility window will close a day after. Who can tell me the reason why your fertility window is closing a day after? Because the egg can only last for about 24 hours. So we are actually using the lifespan of the sperm and the egg to calculate our fertility window. The first equation is from the sperm. The second equation is from the egg. So 5 days for the sperm and a day for the egg. That's how we arrived at those 7 days tentative fertility so-called window. This is the best time to become pregnant. If you are younger, if all factors are equal, unfortunately in medical practice, most times all factors will not be equal. So it's important to understand the reason why we emphasize on regular love making is to increase our chance of getting a positive pregnancy test. Okay? Thank you. I'm going to open the clinic now so you can ask your questions. So please, if you have any questions, go ahead and ask your questions in real time. I'll provide you feedbacks. If you have not subscribed, if today is the first time of attending my clinic, thank you so much. Please remember to subscribe. Click on the subscription button. Ask all your questions. Check out other videos. There are so many important videos that can help you to know your body better, especially if you're believing God to be a mother, if you want to become pregnant, if you want to be a father. There are so many videos in this community that will help you to know better. But right now, please ask your questions directly to me. We still have about approximately 15 minutes to take care of your questions. So it's now question time. Ask me questions on fertility window, fertility and becoming pregnant. Please go ahead and ask your questions right now. Okay? Do you have any questions? Please, if you have any questions, ask right now. I'll provide you feedbacks. Thank you, Kenneth, for coming. My COO is in the house. I'm sure she has a lot of questions to ask. So guys, please ask your questions. Ask your questions, please. Okay, I'm waiting. Do we have any questions? Please feel free to ask your questions. Remember, if you want to talk to me, you can do that. All you need to do is to subscribe. So follow due process, subscribe, and I can meet you halfway. I can help you become a mother, become a father by doing the simple things. Simple things should be kept simple. Common things are called commonly in medical field. So do your own part so that God will do his own part. But right now it's time for questions. I have about 6 people watching. If you have any questions, please ask so I can provide you feedbacks. Okay, so Kenneth is asking the first question. Can you tell us why you discourage fertility window sex for BFB? Now, the reason is because when you end up thinking you are ovulating and you are not ovulating, you will miss that 24-hour window. So some women will have irregular period. And you might have some non-specific signs, like you are ovulating, but you are not, especially if you are above 35. So you can have increase in your cervical egg white mucus, breast tenderness, spotting, pain, and you might think you are ovulating, but you are not ovulating. And your numbers can shift. So a particular month, you can be 25 days. The other month, you can be 29. You can even, so you can fluctuate from that 21 to 35. So if you wait to make love on the day you feel you are ovulating and you miss that opportunity, which is 24 hours. So if you are calculating that you are gonna ovulate on the 15th of April, but you have already ovulated on the 10th, and you are waiting to make love on the 15th, what will happen? You have missed your chance in April. Or you are waiting for day 15, but you are gonna ovulate on day 20, and you will only make love on day 15. What will happen? You will miss your opportunity. So the egg is the determining rate limiting factor in becoming pregnant. The reason why we want you to make love around the corner is to make sure that even when you deposit the sperm in absentia, those sperm can get the eggs pregnant. Remember, the sperm can survive up to 5 days. 5 whole days. So let's do a little mathematics. Your partner lives in Lagos. You live in Abuja. And for some reasons, you guys cannot come together. It happens to some families. I understand that. But guess what? Look, your family cannot wait when it comes to babies. But your job can wait. Your career can wait. Your business can wait. So someone needs to make that movement. But your partner can come back on Monday and you guys can make love up to Wednesday. And he can go back on Thursday and he can still get you pregnant on Monday. Why? Because your partner can start on that Wednesday to deposit a lot of fresh, good quality sperm, which will survive up to 5 days. So if we count Thursday, Friday, Saturday, Sunday, by Monday, you should be getting to the 5th day. So the sperm can still get you pregnant if you release your egg on Sunday or Monday. Very important. Everything I'm telling you is very important, very practical. So if you are among the people that wait to make love on a particular day to achieve magic, stop doing that. You're wasting your opportunity. We don't have time to waste our opportunity. What do we do in our group? Every other day. Make love today, have a break tomorrow, continue the following day completely. Some women will even prefer to make love when they are bleeding. It's okay. There is no problem with that. But please just make love for us, okay? All right. Okay, please, if you have other questions, please ask. Good evening, Doc. Please, your question is this. You'll be 25 by July. You'll be married for 6 months. You are not pregnant, although you have BMI of 32. Very, very, very high. You cannot be 25, my sister, and you have a BMI of 32.7. Your BMI range is telling us that you have obesity problem, and obesity is a medical problem. Okay, so now you have a lot of advantages. You're young, you're 25, so you have a lot of years to play with. Now, the best advice I will give you if you're my younger sister is to watch your lifestyle. So definitely watch what you eat, definitely exercise, definitely sleep, avoid stress. But the biggest culprit in adding body weight is lack of activity. So you have to eat right. You have to exercise every day. Please take my advice. You have been married for how many months? 6 months. You are 25. My sister, you have a lot of time, plenty time. So I want you to focus on getting back to health. Your BMI is not good. Your target should be 18.5 to 25.5. You cannot have BMI of 32.7. It's too high. So concentrate more on being fit. Concentrate more on being healthy before you become pregnant. Look, I know why I'm telling you this. So many women are in a hurry. They want to become pregnant by their own time. But the time you want to become pregnant might not be the time that God wants you to become pregnant, because What you are, you're going to translate to your baby. If you are healthy, you're going to give your baby health. Like in your own case, your BMI is high, so you might become pregnant and you will develop diabetes. You might develop complications. You might have a baby that will be big. You might have hypertension in pregnancy. So there are so many complications you can have when your body weight is in the obesity range. So your major business now is not to become pregnant. If you ask me, your major business is to be healthy, to be fit, to be well before you think of becoming pregnant. Why? Because you have advantage. You are just 25. Please go home and consider this, okay? All right. Now, because you're below 35, you have to meet your partner for 12 months, 12 completed months, every other day. Now, at the expiration of the 12th month, if you are not pregnant, then we'll begin to treat you as a woman that has infertility. Now, if you're 35 years and above, 6 months. If you are 40, almost immediately. So your age will determine when we can classify you as a woman that has infertility. In your own case, you are 25 and you're just married for 6 months, right? And probably you guys are trying, but if you ask me, stop trying now. Concentrate more on health. Make sure your partner is also prioritizing health. The partners that work together in health will also have healthy pregnancy and have healthy babies. So concentrate on what you eat. Go and exercise, okay? Is fertility window the same as ovulation day? No. Ovulation day is part of fertility window. Ovulation day is the day you will release the egg. But your fertility window is the tentative 7 days period when you have the best chance of becoming pregnant. It starts 5 days before your ovulation day and ends a day after your ovulation. That's the fertility window. It's not the same thing with your ovulation day. Your ovulation day is part of the fertility window. Okay? Very important. I love that question. Please ask your questions. 3 more minutes. 3 more minutes to go. Tosi, I hope you enjoyed the symposium. You attended as our guest. I hope you had fun. I hope you're telling your friends you've attended all our clinics. And I want to see your friends attending our clinics the same way you've been attending our clinics. But guys, ask me questions. This is your opportunity. I think some medical students are in attendance too. Please, if you're a medical student out there, you can also ask your questions so I can provide you feedback. Ask your questions. Make sure you subscribe. Don't leave the clinics today if you are not subscribed. Check your notifications so that anytime I'm coming live, they will tell you, hey, Dr. Trudy is going to come live. So you will benefit. The more you frequent my clinics, the more you know your body better, the more you improve your chance of becoming a mother, the more you improve your chance of becoming a father. You can become. The problems are not unsolvable. We can solve all problems with God. Okay, but guys, do you still have any questions? Are we good? This is a pretty straightforward topic. So if we don't have any other question, okay, how long does the ovulation last? 24 hours. So it's a day thing. 24. Okay? As against the sperm that can last for 5 days. Ovulation is a day event. A day. So that's why we need to be careful. That's why we need to make love around the corner so that once we have an egg, there should be a sperm that will fertilize that egg. Some women will release their egg by 1 a.m. 1 a.m. is when you're sleeping. By the time you're waking up, you've already lost 6 hours. By the time you go to work, by 12, you've already lost another 6 hours, 12 hours. By the time you come back from work, let's say you're coming back from work by 6, you've already lost another 6 hours, right? Now, your partner might come back and he's tired. So he might not even be in the mood to make love. What will happen by 12 midnight? You've already finished your ovulation. There is no longer an egg to fertilize. But if your partner made love to you and inside your vagina and inside your cervix and inside your womb, you still have some sperm to get you pregnant, you can still become pregnant even if your partner is tired. So the reason why we give you one day gap is to refuel, to recover. But if you can make love every day, make love. The more you make love, the better for us. Okay? Guys, do you guys still have any questions? This is your opportunity. This is your opportunity. Make sure you join all our platforms. Now, the month of April was amazing. We talked about gender selection and family balancing. If you missed that class, you missed a lot. You missed a lot. Now, don't miss May. May is going to be a different approach. We are going to devote May to all advanced in maternal age women. So all our loving, amazing, beautiful women from age 35 up, May is your own symposium. May is your special masterclass. Go and work towards attending. We are going to bring a subject matter specialist to deconstruct everything about advancing maternal age and work with you and make sure you understand your option and make sure you understand your journey so you can become a mother exactly when God wants you to become. So keep a day with us in May. Okay? All right. Thank you for coming. The clinic is over. I'll see you guys again on Saturday. Until I see you, God bless you and enjoy the rest of your evening. Bye-bye for now.